Question 1. A TB patient on long-term therapy reports blurred vision. What is the nurse's best response? A. Advise the patient to wear sunglasses. B. Discontinue medication immediately. C. Report the symptom to the provider. D. Instruct the patient to wait 24 hours. Answer. C. Report the symptom to the provider. Question 2. What is the priority nursing action after a positive TB skin test in an asymptomatic patient? A. Start isoniazid immediately. B. Schedule a chest X-ray. C. Begin airborne precautions. D. Notify public health authorities. Answer. B. Schedule a chest X-ray. Question 3. Which patient should be tested for TB first in an outpatient clinic? A. A teacher with mild fatigue. B. A visitor recently returned from Africa with cough. C. A child with a rash. D. An adult with a sprained ankle. Answer. B. A visitor recently returned from Africa with cough. Question 4. What is the primary reason TB treatment includes multiple drugs? A. To reduce cost. B. To increase compliance. C. To prevent drug resistance. D. To shorten treatment time. Answer. C. To prevent drug resistance. Question 5. Which of the following is a major side effect of ethambutol? A. Vision changes. B. Skin rashes. C. Hearing loss. D. Dizziness. Answer. A. Vision changes. Question 6. Which meal instruction is important for a patient taking isoniazid? A. Avoid citrus fruits. B. Take with high-fat food. C. Avoid food high in tyramine. D. Eat large amounts of dairy. Answer. C. Avoid food high in tyramine. Question 7. A nurse suspects active TB in a newly admitted patient. What action is most appropriate? A. Assign to a semi-private room. B. Begin contact precautions. C. Initiate airborne isolation. D. Collect blood cultures. Answer. C. Initiate airborne isolation. Question 8. What is the minimum number of sputum samples needed to confirm TB? A. 1 early morning sample. B. 2 random samples. C. 3 consecutive morning samples. D. 1 sample and chest X-ray. Answer. C. 3 consecutive morning samples. Question 9. A nurse is educating a patient on TB transmission. Which statement is correct? A. You can spread TB by sharing food. B. TB is spread through sexual contact. C. TB spreads through airborne droplets. D. Only blood exposure can transmit TB. Answer. C. TB spreads through airborne droplets. Question 10. What should a nurse monitor for in a TB patient taking rifampin? A. Hyperglycemia. B. Hematuria. C. Hepatotoxicity. D. Constipation. Answer. C. Hepatotoxicity. Question 11. What dietary supplement is often prescribed with isoniazid? A. Iron. B. Vitamin D. C. Pyridoxine, vitamin B6. D. Folic acid. Answer. C. Pyridoxine, vitamin B6. Question 12. Which patient would be a priority for TB screening in a community health setting? A. A healthy adult in college. B. A child vaccinated with BCG. C. A recent immigrant from Southeast Asia. D. An elderly woman with no TB history. Answer. C. A recent immigrant from Southeast Asia. Question 13. What instruction should be given to a TB patient prescribed rifampin? A. Report yellowing of the skin immediately. B. This drug may cause insomnia. C. Avoid protein-rich foods. D. Take with antacids to prevent nausea. Answer. A. report yellowing of the skin immediately. Question 14. Which staff member requires immediate re-education about TB precautions? A. Nurse entering room with N95 mask. B. Housekeeper using surgical mask in TB room. C. Physician performing exam with N95 mask. D. Visitor wearing N95 and gown. Answer. B. Housekeeper using surgical mask in TB room. Question 15. What does a 12 millimeters in duration indicate in a healthy adult with no TB risk? A. Negative result. B. Equivocal result. C. Positive result. D. Retest in 1 month. Answer. C. Positive result. Question 16. What nursing diagnosis is most appropriate for a patient with active pulmonary TB? A. Risk for deficient fluid volume. B. Activity intolerance. C. Impaired gas exchange. D. Risk for falls. Answer. C. Impaired gas exchange. Question 17. A TB patient on multiple medications develops fatigue and dark urine. What is the likely cause? A. Dehydration. B. Hepatic dysfunction. C. Anemia. D. Viral infection. Answer. B. Hepatic dysfunction. Question 18. What's the first step in evaluating TB treatment effectiveness? A. Increased appetite. B. Weight gain. C. Negative sputum culture. D. Resolution of fever. Answer. C. Negative sputum culture. Question 19. What should the nurse do if a TB patient repeatedly refuses medication? A. Document and ignore refusal. B. Educate on consequences of noncompliance. C. Ask a family member to force medication. D. Substitute a different medication. Answer. B. Educate on consequences of noncompliance. Question 20. Which nursing action helps reduce TB transmission in the home setting? A. Encourage use of humidifiers. B. Provide gloves for family members. C. Educate on proper cough etiquette and ventilation. D. Advise against all social interaction. Answer. C. Educate on proper cough etiquette and ventilation. Question 21. A patient with TB is started on 4-drug therapy. What lab should the nurse monitor most closely? A. BUN and creatinine. B. Liver function tests. C. Serum calcium. D. Coagulation profile. Answer. B. Liver function tests. Question 22. A nurse reviews a TB patient's chart and sees conversion from positive to negative sputum cultures. What does this indicate? A. Patient is cured. B. Patient is non-infectious. C. Therapy failed. D. Patient requires isolation. Answer. B. Patient is non-infectious. Question 23. What is the best intervention to reduce TB transmission in a hospital setting? A. Administer antibiotics. B. Provide surgical masks to patients. C. Enforce airborne precautions. D. Limit visitors to daytime hours. Answer. C. Enforce airborne precautions. Question 24. Which patient should the nurse assess first? A. TB patient with mild cough. B. TB patient with blood and sputum. C. TB patient reporting fatigue. D. TB patient who missed 1 dose. Answer. B. TB patient with blood and sputum. Question 25. A UAP enters a TB isolation room without an N95 respirator. What is the nurse's priority action? A. File an incident report. B. Educate the UAP immediately. C. Remove the UAP from the room. D. Inform the nursing supervisor. Answer. C. Remove the UAP from the room. Question 26. What is the nurse's responsibility during TB screening for healthcare workers? A. Administer antibiotics. B. Document weight and height. C. Administer and read the tuberculin skin test. D. Interpret X-ray findings. Answer. C. Administer and read the tuberculin skin test. Question 27. A TB patient taking rifampin reports red-orange tears. What should the nurse do? A. Hold the medication. B. Notify the provider immediately. C. Explain this is an expected effect. D. Discontinue therapy. Answer. C. Explain this is an expected effect. Question 28. Which action best supports infection control at home for a TB patient? A. Isolating in a closed, small room. B. Opening windows for ventilation. C. Using a humidifier. D. Limiting all movement. Answer. B. Opening windows for ventilation. Question 29. A TB patient becomes non-compliant. What community resource is most helpful? A. Police services. B. Social worker. C. Pharmacist. D. Occupational therapist. Answer. B. Social worker. Question 30. What is the nurse's primary concern with a TB patient on isoniazid and rifampin? A. Dehydration. B. Liver toxicity. C. Bradycardia. D. Skin thinning. Answer. B. Liver toxicity. Question 31. A TB patient asks why treatment lasts several months. Which explanation is best? A. It reduces the risk of side effects. B. TB organisms multiply slowly. C. It allows for fewer doctor visits. D. The body absorbs the drugs slowly. Answer. B. TB organisms multiply slowly. Question 32. Which symptom suggests extrapulmonary TB? A. Productive cough. B. Night sweats. C. Back pain and stiffness. D. Fatigue. Answer. C. Back pain and stiffness. Question 33. What is the best nurse response to a TB patient concerned about infecting family? A. Avoid contact with them completely. B. Use separate utensils at home. C. With precautions you can prevent spread. D. All families should start medication now. Answer. C. With precautions you can prevent spread. Question 34. Which client is most at risk for TB reactivation? A. A young adult with bronchitis. B. A patient on immunosuppressive therapy. C. An elderly person with mild COPD. D. A teen with allergic rhinitis. Answer. B. A patient on immunosuppressive therapy. Question 35. A nurse is planning care for multiple patients. Who should be placed in a negative pressure room? A. Pneumonia patient. B. TB patient. C. COPD patient. D. Lung cancer patient. Answer. B. TB patient. Question 36. What is the nurse's priority after identifying TB exposure in a healthcare worker? A. Administer antibiotics. B. Start airborne precautions. C. Schedule TB skin test. D. Notify infection control. Answer. C. Schedule TB skin test. Question 37. Which statement shows effective TB education? A. I will take all my medication even if I feel better. B. I only need to take the medicine for 2 weeks. C. I can stop taking meds if I wear a mask. D. TB is not contagious at all. Answer. A. I will take all my medication even if I feel better. Question 38. A patient with TB is placed in airborne precautions. Which sign should be posted? A. Gloves and gown required. B. Standard precautions only. C. Negative pressure required. N95 mask. D. Droplet precautions in effect. Answer. C. Negative pressure required. N95 mask. Question 39. When should a TB patient wear a mask in the hospital? A. Only while sleeping. B. When leaving the isolation room. C. Only when visitors are present. D. At all times in the room. Answer. B. When leaving the isolation room. Question 40. Which is the most effective method to evaluate a TB patient's response to treatment? A. Patient's weight gain. B. Reduced coughing. C. Negative sputum culture. D. Normal chest X-ray. Answer. C. Negative sputum culture. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.